get it done. And I yield back.
Gentle lady, yield.
Certainly.
You've got me all excited now. It's taken so long to get to this point. It's very frustrating. I mean, back in when we first got here, the class of '06, we got to initiate bills in '07 in the first few months, and as they say here, I dropped a bill called No Discrimination to apply our constitutional rights to prevent us from being discriminated against, to prevent the insurance companies from cherry-picking people out. I don't know how it is in Pennsylvania, but in Wisconsin, in my neighborhood, I grew up in a neighborhood, but that neighborhood has been chopped apart by the insurance industry. The insurance industry was allowed to separate Mrs. Koss or Mr. Romer out of the risk pool because they had some condition they didn't want to touch or insure. And it's gotten to the point now where even some mothers may be split from their family because they have a condition, but their children can be insured, but they can't. So I like the idea that we're going to get primary care and access to primary care, but as you know, we don't have enough doctors and nurses right now. So we have to invest in a possibility to make sure that our students can go to school and perhaps have their funding paid for through medical school, and in return give us those years back in terms of service in primary care where that need most exists. And in my district, which is a rural district, I would point you to the rural district of northern Wisconsin. As Mr. Courtney has brought out so elegantly about the VA system, I'd ask this question, not only to him, but to everybody in the country. Is there any reason why a soldier served only for himself or herself to get that benefit at the VA at the pharmacy? If a soldier has a VA benefit and has a discount, a medication available at a lower price, is there any reason not to provide his entire or her entire family with that same medication at that price? And what about his neighborhood? What about his community? In fact, what about the whole United States? No soldier today is serving in Iraq and Afghanistan for him or herself. They're there for our nation. And if the VA was successful in negotiating a steep discount for a given medication, I think that price ought to be available to anyone who's willing and in need of that medication. And Mr. Klein from Florida mentioned that he might be taking a medication. Is there any reason that it continues to exist today, that if I go into a pharmacy anywhere in the country, if all four of us are in line to get the same exact prescription, the same number of pills, we're going to pay 4 different prices for the same thing? I think not. I think we have to have complete transparency, and the price that one should pay for a medication is the lowest price available within that community, and that price should be openly disclosed. And no one put it better than one of my constituents, Sally from Kaukauna, another city that Barack Obama has visited in my district. I tell you, this guy Obama's everywhere. Quote, "Our prescriptions cost $1,000 a month. This is a very big issue for us," close quotes. Well, heck yeah. If you don't have the money, you're not going to get the medication you require just to survive. So I would submit to you that it's time to end discrimination in health care. And when we do, that form of discrimination that takes place at the pharmacy, where Mr. Klein might get charged 3 times what the person in line next to him for the same medication, to me that's a form of discrimination. And I think it's time that that form of discrimination came to an end. We have to have openness and transparency in prescription drugs and be allowed to negotiate for a lower price. I yield.
Well, and Mr.